Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Which of the following statements are related to tubercular salpingitis except tubercular salpingitis? If you see, abdominal ostium may be present with eversion of fimbriae. True. Early lesion may be confused with adenocarcinoma on histology. This is also true. Then genital tuberculosis is always secondary and the tubes are invariably the primary site. True. Salpingitis isthmica nodosa is the exclusive pathology of tuberculosis. It is not exclusive, but it can be present in tuberculosis. So this is the false statement. A true statement about female genital tuberculosis is polymerase chain reaction techniques have got greater technique or greater sensitivity of detection in female genital tuberculosis. Next, risk
Genital tract involvement results from lymphatic spread. It is not lymphatic spread, it is actually hematogenous spread. So this is not lymphatic spread, this is actually hematogenous spread. Then premenstrual histopathological examination is diagnostic. No, it is not diagnostic. Histopathological examination is not diagnostic. Reproductive outcomes following anti-tuberculous chemotherapy is satisfactory. No. Reproductive outcome after anti-tuberculosis is mostly it is difficult because tubal blockade is seen with the help of adhesions. So we should do adhesiolysis, surgeries should be done. So it is not satisfactory.
Next, risk factors of acute pelvic inflammatory disease are all except menstruating teenagers who have multiple sex partners. True. IUCDs. True. Women with monogamous partner who had vasectomy. False. Previous history of acute PID. So pelvic inflammatory disease is seen in these cases, not seen in women who have monogamous partner who had vasectomy. Then, which of the following are primary sites of acute gonococcal infection except acute gonococcal infection is seen in urethra, Bartholin glands and skin glands. It is not seen in ectocervix.
It is seen in endocervix, not ectocervix.
Then, ulceration of vulva is commonly seen in all except ulceration of vulva is seen in syphilis, chancroids and Behçet's disease. It is not seen in bacterial vaginosis. Then, regarding bacterial vaginosis, all are true except in bacterial vaginosis, homogeneous vaginal discharge with pH of 5-6 is 5 to 6 is seen. Positive KH, which shows fishy odor. Positive clue cells are seen in 100% is false. It is diagnostic but seen in only 40%. It is due to Gardnerella vaginalis. That is true. So this is false statement.
thank you and thank you for watching.